a standing meeting where we don't have an external speaker, so nobody's expected to give any talks. But what we typically do in these standing meetings is just go over what projects we're working on and where things are or what we want to do, and kind of just give a little update of where different projects are. So some of you are new and so you don't have specific projects, but you can talk about what you're interested in, where you want to get involved, and that gives the other folks a sense of who they can connect you with, or who would want to connect with you. So with that, I'll go first since I'm talking already. So Sudha Jayaraman, I'm the director of the Center for Global Surgery. The big update this week is that we finally got published a paper that describes, outlines competencies in academic global surgery. And what that means is that we got together roughly 60 people across the world, across just about every continent, surgeons, anesthesiologists, education experts, to say, what is this field of global surgery and what are the main principles that somebody who's interested in it would want to learn, whether they're an anesthesiologist in Botswana or a surgical tech in India. What are the fundamental things that they should learn about? And so that's super exciting. That just got published. I'm hoping that the department will put out a little news release or a press release about that. And we're already, because I was the person spearheading it, we're already using some of that competency information to create our own academic global surgery course that will be available, that's in progress of being available. And Tan can talk a little bit about it because he's been working on it for the last year. And that hopefully will make into a School of Medicine and lower campus university course as sort of a background for anybody who's interested in this space. And it's, obviously it'll be like a free online course, asynchronous, no expectations of any grades or anything like that. But we will, I assume that we'll keep it pass fail, and we'll create like a certificate for those who complete it. So that's the project update for one of my projects, but the most recent and exciting thing, because I've been pushing that project up the hill for like 2 years. So I'm just thrilled that it's gotten to where it is. Anyone else want to go ahead? Catherine, do you want to go ahead?
Sure. So I'm Catherine DeVries. Many of you know me. I'm feeling bad, Eric, that I haven't responded to your email, but I haven't forgotten, so I will. But I have a wedding happening actually up here next week, and followed by a big meeting on pediatric urology, where we will be presenting our task force. So we have a global surgery task force that has been surveying pediatric urologists from North America. We have about 120 of them. And we've been putting together a tool to keep the information current for where people are working. By that, I mean where they work in the United States or North America, where they work overseas, generally in the global South, somewhere. Many of them work in Asia and Africa, fewer in Latin America. But people work in various networks. Some are in academics, some of them work with different NGOs, some of them work with faith-based organizations. But we have not had a repository where we keep all this information and where we can share it. And we may find that someone we know is working in very much the same place at different times of the year, and nobody knows that. So that is near its completion in terms of putting it together. And we'll be presenting on that
it's just this right now.
next week.
Liz, could you please mute your microphone? Thanks.
So it's it's all going to feed into InterSurgeon, which, if you're familiar with InterSurgeon, is a website that was developed in England by a neurosurgeon, pediatric neurosurgeon colleague of ours, in particular for pediatric surgery and specialties, but it's useful for adult surgery and specialties as well. And it's a website that actually maps out people who have joined InterSurgeon to identify where they work on which projects and how to collaborate. So that's been going on now for maybe 5 years or so. So this whole project that we have done with the North American pediatric urologists will feed into that. And there is a parallel assessment going on in Africa that is being led by one of our African colleagues in Uganda. So that's a parallel one. And there is another parallel one that the Canadians, who did not want to, they wanted to do their own thing, but they wanted our template. So they're taking our template and doing their thing. But at any rate, it's all going to feed into the same common sources that will share all this information on a global scale.
And is that accessible to people anywhere, or what is the accessibility of the InterSurgeon?
Well, right now it is housed in the University of Utah CTSI. But it will go live very soon. We're just working out a couple of little things. We sent it out to the organization committee for their final tweaks. And then as soon as we get it back, Hafsa has already started putting in data that we've gotten when we did a SurveyMonkey. But the SurveyMonkey turned out to be totally unwieldy. And we got big spreadsheets that are unusable. So this has turned it into sort of a, gosh, I'm trying to remember the exact term. But it allows multiple functionalities within REDCap. And there's a design of REDCap that I am not familiar with. And we had to design 3 separate projects within REDCap that all will merge into one survey process.
Okay. All right, great. Well, I was just curious that at some point when it's done, we should publicize it through our networks so that our partners have access to it and have a sense of who they could potentially collaborate with.
Yeah, branching logic was the word that I forgot. So yeah. It's design of branching logic networks that I didn't have expertise on. But now that we've got that, we're populating it with the data.
Great, that's fantastic. Thank you. Questions for Dr. Jabriz, anybody? Or suggestions? Thank you. Dr. Sabai, do you want to talk a little bit about your project? Sorry to hear about the big earthquake in Morocco this past Friday. I hope your friends and family are doing okay, and the need for your neuro rehab services just exploded in that country.
Yeah, thanks for the note and the kind word. It's been very tough, emotionally and physically. The first day was a sleepless night and a lot of worries, but thanks God, everybody in the family, friends, and colleagues at the rehab center are doing are healthy and doing okay. A couple of them are homeless; they lost their home. Their building is condemned, but and the clinic is shut down, like a lot of facility around the city, because of the sort of emergency status that's been enforced to try to basically create access to all parts of the city and take care of the urgent medical need of the population. Yeah, I presume in the next several months, we will have to deal with a lot of cases, more than what we can take care of, unfortunately. But we are ready to do our best, that's for sure.
Incredible. Well, I think certainly this group, this globally minded group, I think so we all send our wishes, and if there's anything that we all can do, please let us know.
Thank you. Yeah, appreciate it.
Yeah. And are you planning on going to Morocco soon for your for the rehab project? Because I thought you were going with a team this fall.
Yeah, we were planning actually going in the middle of next month, in this October 16. And we're continuing to work on what we need as far as the educational materials, but we're conscious that we may skip that trip and then reschedule it.
Yeah.
Crossing fingers, hoping for the best, but we will see.
Fantastic. And I think Cody Orton, who's one of our medical students, wanted to help with the project. I don't know if he's had a chance to connect with you since, but
I was going to reach out to him in the
look at that,
last week or so, and then these things happen. Yeah.
Yeah.
Cody, I know you're there, so I'm not forgetting about you.
Yeah.
Sounds good. Yeah, no worries. No worries at all.
Yeah. Great. Okay. Well, if there's opportunities to connect on work on things for that, I think Dr. Sibai, you can let us know. Yeah. Okay. Thank you. Who else would like to talk a little bit about their work? Dr. Femi, you're new to this group. I wonder if you could introduce yourself and tell us a little bit about what you're involved in. Can you hear us, Dr. Femi? No, maybe not.
Hello.
Yes. Hello, go ahead.
Sorry, I lost connection a while ago, and I guess sorry, I'm Femi Odushola. I lost connection a while ago, and I guess what we're doing at this time is to introduce ourselves, right? And talk a little bit about
our projects, whatever projects you're working on. Yeah.
Oh, I see.
Yeah.
Okay. I'm Femi Odushola. I'm a medical doctor based in Lagos, Nigeria. I'm a public health physician. Primarily, I also been involved in research, principally in two basic areas. Previously, before now, I've been involved a lot with cardiovascular research that's focused essentially on preventing cardiovascular diseases by addressing the risk factors, hypertension, diabetes, and dyslipidemia and all that. And I did a lot of this while I was in the Netherlands, and we have our research fields in Nigeria, in the rural part of central part of Nigeria. And our focus was to see how to improve the capacity of people diagnosed with hypertension, with diabetes and all that, their capacity to prevent, to avoid coming down with cardiovascular diseases. And so we did a couple of work, and we did publish a couple of works on that. Principally, we developed a cardiovascular health education program, which was meant to assist hypertensive and diabetic patients to become more capable in taking charge of their health and in doing what they are expected to do to prevent the development of cardiovascular diseases. Going further from that, in recent years, I seem to move on to research on trauma and injuries. Basically, my focus was in the emergency system, especially in the pre-hospital arm of the emergency spectrum. So we, here in Lagos State, we were focused on working on how to improve the quality of pre-hospital trauma care that is made available to the residents of Lagos State. And this was also a lot of work that Professor Femi Wereku spearheads. So I was just working under that atmosphere, and then so our focus was to see how we can improve the quality of healthcare, that a quality of pre-hospital care, pre-hospital trauma care that's available to residents in Lagos State. Of course, the work that Professor Femi is doing is much larger than that, but I'm just talking about the aspect that I've been involved with. And so we also do capacity building for ambulance personnel. Like we have in the only public emergency service in Lagos State, and at the time in the whole of Nigeria, was the Lagos State Ambulance Service. We call Lagos State Ambulance Lasambos, and it has about 250 personnel, majority of whom, about 90% of whom are medical technicians, nurses, and a few doctors. But also we have those who are non-medical, like the drivers and ambulance. So at a stage, we try to build capacity by arranging trainings for them in basic life support, in first aid and all that. So beyond building capacity, we also been involved in researching into what are the areas or factors that have been responsible for delays in having victims of crash, or victims of accidents, or road traffic accidents, or road traffic crashes, or victims of building collapse, or other forms of traumas and injuries, getting prompt access to necessary care. So we try to address that aspect of a problem, in the sense that we realized from some of the data that we gathered that quite a number of factors could be responsible in this part of the world, low resource setting, for delays. It could be traffic congestion. Maybe there's even an ambulance, and the ambulance could not get to the crash site early enough because of traffic congestion, or because of bad roads, or because of bad weather, or because of so many factors, security issues along the route, or even behavioral issues like other motorists not being enlightened enough to know that they have to give the right of way to an ambulance. And this happens in Nigeria. You have other motorists struggling for right of way with an ambulance that is bearing the siren. And so those are a couple of things that are responsible for delay. So we looked at these, and we felt we need to address that aspect, so that the quality of pre-hospital trauma care that's available to people who are involved in accidents is improved. So once we're able to bridge this gap of communication, the gap of early access to care within the golden hour, that's the first hour after the crash occurred, that should improve the kind of care that, the quality of the care that is accessible to those patients. So we also look at that as what is delaying the communication between the public caller, who is an eyewitness to an accident or a crash, and the time that the ambulance eventually gets notified and gets to crash site. A call is made, and the the command center or the call center receives the call, processes the call, and transmits the call to the nearest ambulance to the site of the crash. And the nearest ambulance to the site of the crash dispatches and gets to the crash site. So this is also a communication line that if there are interruptions or if there are delays, it could also affect the outcome of care, of the pre-hospital trauma care that accessible. So recently, a mobile application was developed to try and improve the seamlessness and the efficiency of transmission of emergency calls from the public to the call center, eventually to the ambulance, which is dispatched to the crash site. So we're looking at, most of the work that I've been involved in is looking at the pre-hospital arm of the emergency spectrum, trauma indeed. And of course, we're also going to be talking, this qualitative part of our research. We also plan to be talking to stakeholders in the emergency care delivery, the fire service, the road safety service, the ambulance services, the police traffic department, and a couple of others, trying to assess what is their view with regards to how care is being given at the moment and what they feel can improve the quality of care that is accessible to or available to residents. We're doing all this. We're in the midst of some of these things. We have a couple of papers, maybe 2 published. One is under consideration at the moment. And so basically that's what we've been doing in Lagos now. Thank you.
Yeah, thank you, Dr. Femi. That's an incredible amount of work. And I don't know if everyone from our group here knows that our new chair, Dr. Nwariaku, has been leading a lot of this effort for many years and is a partner of Dr. Femi and others on this project. And that Nigeria is the country with the largest population across the continent of Africa, and about 200 million people, which is about 2/3 the size of the US. And Lagos State is about 15 million people. So imagine that being the only place where there is any organized EMS system. There's an enormous amount of work that needs to be done. And it's, you're pushing a big, enormous rock up the hill, Dr. Femi. And my goodness, it's quite inspirational to hear about the challenges that you and the team are working on. So thank you for sharing. Questions for Dr. Femi from anyone? Okay. Well, thank you, Dr. Femi. We'd love to have you as one of our speakers in the future sessions of this meeting, so that you can actually share with us in more detail and more specifically about your projects. I think that would be fantastic.
That would be great. Thank you.
Yeah.
I'm actually curious to know what connections, what are all the connections you have with the University of Utah, as far as Nigeria is concerned.
I don't know that we have too many connections with colleagues in Nigeria, at least that I'm aware of, outside of our chair, Dr. Nwariaku. And I'm sure Dr. Dries probably has connections in the urology side through international societies, but I actually don't know.
Yes, I do.
Yeah, I'd imagine. I know some of the general surgeons, but I'm not officially working with anybody specifically. Do you know, Catherine, of any other partnerships between the University of Utah and colleagues in Nigeria?
I don't know of anything that's currently ongoing, but there have been in the past. And one of them actually was partly collaborating with work that Dr. Nwariaku did years ago, having to do with transplant surgery, back when he was in Texas, and with some of our friends in Delta State. But then in past years, I've also worked in JOS, and that collaboration isn't current right now, and with some colleagues in Abuja. So we have several things happening in urology, but they become more or less active depending on other things. Currently, they're not very active.
Thank you, Dr. Ruiz. Okay, thank you, Dr. Femi, for sharing your work. We'll go around and we'll have some of the other people to share a little bit about what they're working on. Kate, I know you're new to this group. Would you like to share a little bit about your background and what you would like to, what connections you're trying to make?
Yeah, absolutely. Thank you so much. Yeah, it's I'm just thrilled to meet you all and kind of join this group. I'm Kate Carey. I'm a nurse practitioner currently at the University Hospital with the Palliative Care Service. The bulk of my nursing background prior to that was in trauma and surgical ICU care, and just looking to find a place for my passions in both palliative care, surgery, and global health. And we have the immense honor of having Dr. Kate Harris has joined our team as part of our fellowship in the palliative service. And she and I have started some exciting conversations about how to, really expand palliative care access and pain and symptom management access in the global health realm. But otherwise, just looking to learn a lot more about what this team is doing and what other connections, could be made. So thank you for having me.
Yeah, thanks for joining. Cancer and palliative care are such an important part of surgical care. So we have to think about surgical care more broadly. And so thank you for talking a little bit about that. Any questions or suggestions?
Okay. I'm sorry,
yes. Catherine.
But yes. Just so that people are aware, we are members of the G4 Alliance. And the G4 Alliance is an alliance that includes nursing along with OBGYN, trauma, anesthesia care. And it is a rather broad alliance, but it includes a lot of subgroups and working groups that touch on many aspects of care. And so as a member of this organization, any of us at the University of Utah can tap into those. And palliative care is one of them. And also there's a rather large nursing group. So I just wanted the people who are on this call to know that we have resources that we can connect to through the Center for Global Surgery and beyond us, even in projects that we're not specifically working in.
That's fantastic. That's a great point. I think maybe, Kate, I'll connect you with Dr. Reese by email, and then and she can kind of connect you into the right committees there at the G4 Alliance. What do you think?
Lovely, thank you.
Yeah, that's great. Thank you, Catherine, for mentioning that. We're connected to all these different societies around the world, and no one person in this group knows everything, right? So that's why we have a group, so we can share and make connections that make sense for everybody. That's fantastic. So well, thank you very much. And I don't know if you saw this this current Lancet Commission on Women, Power, and Cancer that is happening in the next, I want to say in the next few weeks. But Utah time, it's really early in the morning, like 6 o'clock in the morning or something like that. But I don't know if you've seen that. If anybody else is interested in that, I can find and forward that session. I think it's a couple of hours long. It's not all day, and I think it's available virtually. So that might be worth exploring. So great. Well, thank you very much for sharing your interests. Dr. Ayotemi, we were just exchanging some emails. Would you care to introduce yourself and talk a little bit about what you're involved in? The connection may not be good.
Yes, I can hear you. Good afternoon. Good afternoon, Dr. Sudha.
Good afternoon,
everyone.
Yeah, welcome.
Yes, my name is Ayotemi Oluwabemi. Thank you. I am a Nigerian practicing in Nigeria for about 2 years now, and Yes, I have great interest in general surgery. I have been involved in some research, some surgical and some non-surgical. Also involved in an organization that offers free surgery for cleft lip and cleft palate. Is an initiative that works around across Africa and mostly around across states in Nigeria. Yes, I joined around March and I've been involved in some of these free surgeries. Yes, and that's majorly what I'm doing for now, and also preparing for my step one USMLE. I'm working towards doing a residency in US in general surgery.
Okay, great. Well, thank you very much. And I assume that you're also working with Dr. Femi and Dr. Noriaku.
Yes, I am. I'm working with Dr. Fiamon, yes.
Yeah, okay. Okay, wonderful. Thank you for sharing. Really appreciate that. Dr. Tina? I don't know you, but maybe you can introduce yourself. Okay, not sure if she is able to join. Okay, Tan, why don't you talk a little bit about what you've been working on?
Sure. Hi, my name is Tan. As Dr. Jayaraman mentioned earlier, I'm working on an Intro to Academic Global Surgery course with Anna Dorelli Anderson, who's not here on this at this moment, but her and I are kind of developing a two-pronged course for both. More introductory for general audiences and more of a professional audience for academic global surgery, which includes about 10, 11 different modules that we're working on right now, and an array of different media and types of activities to have a much more engaged and inclusive conversation about academic global surgery. Oh, hi, Anna. Cool. As of now, I think we are waiting on the Tom Hall grant, if I'm right, and waiting for a response for them to see if we can get additional funding from there. But I'm to be determined.
Yeah, thank you very much, Tan. And so the Tom Hall grant is by one of the professional societies, the Consortium of Universities for Global Health. It has various small grants available, and Anna and Tan put together, so I think it's a small grant, $5,000, to develop curricula related to global health and global priorities in education. So, and the goal is to, through that grant, create some videos, create some recordings of different faculty potentially and different topics to be incorporated into this course. So we'll see if we get that grant, but it would be great if we can get it, and it would be great to create a spectacular online course on global surgery that is, freely available through our university for anybody who wants to participate. And that would be pretty awesome. So thank you for your hard work on that, Tan and Anna.
Hi, Sudha.
Yes, hi, Tina.
Yeah, sorry, thank you. Yeah. So my name is Tina Sheyola, I'm a pediatric surgeon from Lagos, Nigeria. And Sudha, actually, I've worked a bit with you on that Delphi.
Yes, I recognize the name. Yes, thank you.
Yeah. So in terms of what I'm currently doing that brought me into this group, I work with Dr. Noriaku, and I'm currently working on a mortuary-based injury surveillance system in Nigeria. So that's the active project that I'm doing right now, trying to improve injury care, injury surveillance, and influence policies that will help to improve outcomes from injury by looking at mortuary-based data for those patients, because most data generally tend to come from patients that come in alive into the accident and emergency. And we don't really know much about those that go straight into the mortuary from the scene of injury. So want to see what happens around the circumstances around their injuries that resulted in them being brought in dead, and see if anything can be done on the ground at that point to improve the outcomes, and reduce all of that. So that's basically what I'm working on right now. And actually, WHO has a document on that, but it's many people are not even aware of it. And so those are the gaps we're trying to fill, and also to train people on how they can incorporate that into their systems. Aside from that, I also see Dr. DeVries here. Yeah, we worked together several years ago. I don't know if she remembers, on instrument and equipment for children's surgery with the Global Initiative for Children's Surgery. Yeah, it's nice to see you again. I was very glad when I saw you. Saw your name on the list. Yes, yeah, done that. So yeah, so I'm actively involved with the Global Initiative for Children's Surgery and working to strengthen surgical systems for children. Yeah, in a nutshell. Thank you.
That's wonderful, Dr. Tina. And may I call you Dr. Tina? I don't quite know how to pronounce your
You can call me Tina. That's fine. Tina is fine.
Because actually we have a new pediatric surgeon who's joining our group at the University of Utah in another month or so, who is just finishing fellowship and is interested in getting involved in global initiatives related to children's surgery. And I've connected her with the GICS group, and I might connect her to you as well. And maybe there's
that'd be fantastic. Yeah, I'd love to pick up with her. Yeah, thank you.
Yeah, that'd be great. Well, Leif, do you want to talk a little bit about what you've been doing?
Yeah, I'd love to. Hi, everyone. My name is Leif Sorensen, and I'm a current undergraduate and MSCI student at the University of Utah. I've been working with the Center for Global Surgery for about 2 years now, and I have 2 main focuses on Mongolia and Cambodia. In Mongolia, I do breast cancer, liver transplant, and advanced traumatic life support. In Cambodia, we do laparoscopic surgery and training. And those are my 2 main projects that I work on. Update, the Cambodia team leaves this Friday, where they will be continuing our laparoscopic training course that we started in the capital city, and they will be expanding that to some of the smaller provinces outside of the capital. So that's very exciting. And that's probably the biggest update that I really have, is that's coming up. Working on the data collection for that. Last time we used REDCap, and it worked great. Transfer over to that country because everything is in English, and I think there was a lot with the consent forms and needing access to internet. So this time we're trying to find some new ways to collect the data that maybe don't take quite as much response from the candidates in an easier survey method. So that's everything really about me. I'm excited to meet the new people, and I hope that if any of you are interested, you can get involved in some of the projects I'm working on. And yeah, thank you.
Great, thanks, Leif. Leif is finishing his undergraduate years in another 6 months, and then hopefully finishing his master's degree as well in another year, and then in the process of applying for medical school. And we hope that he'll join us here at the University of Utah as a medical student, because he already knows a lot of the work that we're involved in. I think it makes sense for us to keep him. So thanks, Leif. Thanks for that update.
Thank you.
And Leif works with Dr. Price and Dr. Brownson and Dr. Rodriguez. So Dr. Price is a general surgeon, and Dr. Brownson is a breast cancer surgeon, and Dr. Rodriguez is a transplant surgeon, all here at the University of Utah. Great. Anybody else who wants to jump in and talk a little bit about what they're interested in? Eric, would you like to introduce yourself? I don't know if Eric's on. Or Cody, would you like to talk a little bit about what you're working on? Maybe you can talk a little bit about the GECKO study.
Yeah, sure. Hey, everyone. So yeah, I'm Cody. I'm a 2nd year med student here at the U. Really interested in global health and global surgery. Like was mentioned before, I've been in touch with Dr. Sabai about his work. And I'm also working with Dr. Nunez primarily on the GECKO study, with a few other 4th year students, but it's kind of just getting ramped up now. Finally got access to like REDCap and things like that. So we're starting to go through some patient data, but it's pretty early for me. I kind of just started, so I don't have a ton of updates about it yet. But yeah, just generally speaking, interested in global health, global surgery, and also global orthopedic and neurosurgery too is really interesting to me. So happy to be part of this.
Great. And Cody, can you tell us a little bit about the GECKO study? can you give us a little one-liner, or should I do that?
You could probably give a better one-liner than I can. So
I know. I want to give you the opportunity to talk about it if you'd like. So GECKO is run by the National Institute of Health Research Global Surgery Unit in the UK, across multiple universities in the UK. And that group has run over the last probably about 4 or 5 years, multi-institutional, multi-country randomized clinical trials, as well as just observational clinical trials. And to the order of the most recent trial that they published, called the CHEETAH trial, looking at surgical infection rates, enrolled something like 13,000 patients from 250 hospitals in 100 different countries. So it's just a phenomenal group to be engaged in. This particular study is looking at laparoscopic operations, specifically for removing the gallbladder, and looking at what the standards are and who meets those standards and perhaps who doesn't, and what criteria they use across all of these different hospitals and institutions around the world. Thank you, Cody. Yep. And what it involves is that there are 9 phases of enrollment of patients, and this is an observational study, so there's no intervention. And what it means is that our institution is one of the institutional partners, and we will take it's a week snapshot at a time, 9 times over the course of the year, and you take all of the patients who have a gallbladder operation during that time, and you capture their data, and then you pool it across all these institutions, across all these countries, to then get a sense of, what do surgeons and practitioners think about the standards in gallbladder surgery, and what are their outcomes. And that's an interesting project for us to be involved in part because some of the work that Leif mentioned and Dr. Price is involved in is actually teaching how to do gallbladder surgery around the world and developing curricula to do that. So it makes sense that we're involved in those kinds of projects because, well, we're helping teach it. So, and we're trying to both generate the data from our standard practice, what's the standard of care here at the University of Utah, and take that and use that to say, well, what should be the standard of care? What should we be teaching? And as you can imagine, a study like this, the results, when you get the results back, you can use that to update your curriculum. You can say, oh, you know what? Out of 10,000 people, this was a gap. So let's make sure that in our training curriculum, we're emphasizing that, or that this complication was more common. And so let's emphasize how to prevent or identify that complication. So there's a lot of potential for us to learn about. So thanks, Cody. I appreciate you getting involved in that. Any comments for Cody or anybody? Or Cody, do you have any other things to add? Cool.
Much better one-liner than I could have given.
Well, it's only because I'm 20 years older than you are. All right, Eric, I think you might be the last person to kind of talk, and then we'll introduce some of our staff who are on as well.
Okay, yeah. Thanks for having me on. Sorry, I've been bouncing back and forth. I'm on wards right now. So I'm a 3rd-year medical student at the University of Kentucky, and I think my interests kind of lie in global surgery right now, and that's why I originally reached out to get a little more involved. I came across IBU Med and a few other things like that. I was interested a little bit in urology, so that's kind of what got me interested on most of that. Prior to med school, I'd worked as a biomedical engineer in undergrad, and that got me some access to some global health projects. At Duke, we did something called the Pratt Pouch Labeling Project for, I believe it was HIV medication. So I guess I kind of came at it more from an engineering background in the past, but currently was just trying to get more experience and just see what projects look like more on the clinical side of things. So I think just looking for ways to help in any way and just kind of broaden my horizons and just kind of see how everything works together is what I was really hoping to get out of it.
Yeah, fantastic. There are, University of Utah is known for innovation work, and so we're trying to tie in global health and global surgery and innovation with that with that expertise. So two specific areas of expertise here under the same roof, and we don't actually work together very much. So we're trying to do exactly that here, and that's part of the master's program that LEAF is participating in. It's a master's track in global health innovation and technology, and to encourage especially clinicians to think about how do you solve problems and how do you acquire the skills to develop innovations, whether it's product or process or programs, quality improvement. Really, how do you develop new ways of solving problems, and then how do you think about studying them or implementing them, which can be quite extraordinarily difficult. Just because you have a great idea and it works well doesn't mean that it actually can be implemented anywhere. And so that's part of what we're trying to organize here at the university. We have a lot of non-surgeons, and I'll say they're non-surgeons, but they're all, in my mind, under the same roof as surgery. Two OB-GYN physicians from Kenya and Rwanda who are here in that program currently, and a nurse midwife from Kenya who's also here in that program. All of them are LEAF's classmates. And then we have last year we had a general medical doctor from Colombia who worked on a cranioplasty device. And we had a OB-GYN from Rwanda who's working on how do you teach women to do self-assessments for cervical cancer care and diagnosis. And then we had another US OB-GYN who was involved in developing a blood test to detect Group B strep, which is an infection that can be transmitted from mother to child very easily. And he's been involved with the engineering school to actually develop the device to test it. Some of you probably know that the Gates Foundation recently has been involved in funding a vaccine to prevent Group B strep. But you still need to diagnose whether they have it or not, or whether they're at risk of transmitting to their infants. So that's a project he's working on, and our fourth person from last year has been working on an infant warmer in Nepal, and actually through that process learning that the government of Nepal really didn't have a medical device regulatory framework, and helping them set that up to say, here's how you here's the safety processes you need to have established to be able to have any kind of medical device, whether it's laparoscopic surgery or infant warmer or whatever it is. So those are some of the types of different projects that our group is involved in some way, shape, or form. So lots of interesting ideas that hopefully, again, with a group like this from around the world, we can come up with those kinds of ideas and we can work on them together. And this is, I guess, the silver lining of COVID is that none of us would have ever had this meeting if it wasn't for a international catastrophe. So maybe we can learn from that. So thoughts, comments, suggestions, anything I've left out? And then Liz and Anna and Xavier are some of our staff who are on in the background who are trying to help organize these partnerships and organize projects and connect different people and create some of the content like the Intro to Global Surgery online content, so that we are all kind of familiar with the same language and the same principles, and kind of can work together and in a more effective manner. So great. Well, a couple of things I wanted to mention. Next week, Dr. Kehinde will be presenting from Nigeria as part of the team with Dr. Noriaku and the other colleagues on today. And so he's going to specifically give a talk on trauma and EMS systems and their work. Talk will be about a half an hour long, maybe 40 minutes with questions. And then the following week, Dr. Budahoski, who's one of our neurosurgeons here at the University of Utah, will be talking about stroke care. He's been involved in a couple of different collaborations related to building capacity in stroke care I believe in Tanzania and Botswana or Zambia, somewhere in Southern Africa. I forget exactly where. So those are our two upcoming speakers for later this month. Typically, we have a couple of speakers every month, and then a couple of sessions every month where it's not as going around and talking about things as we did today, but maybe a few people talking about in more detail what their projects are, what challenges they're running into, and where they need help, and the group sort of jumping in to say, here's what needs to be done next, or here's some ideas, or here are some suggestions on how you can troubleshoot. So there are a couple of meetings every month that are meant to be more freeform, and a couple of meetings every month that are meant to be visiting guest lecturers. So that's how this meeting is structured, and we alternate between Mondays and Wednesdays, knowing that everybody's schedule can vary, and you might have to be in operating or in the clinic or something on one day that you might not have the next day. So that's how we have things organized. Any questions, thoughts, suggestions from anyone? And please send me names of speakers. We'll have I'll invite people who